Hi everyone, I'm Cassie Goodman, and today I'm here with Dr. Curry Winchell, who's the Medical Director of Urgent Care and a physician at St. Mary's Medical Group here in Reno. Thank you for being here today.
Thank you for having me. I'm excited to be here.
Good. So today we really want to focus on the health disparities between Black women and white women when it comes to screening mammograms. So from your perspective, why is it so important for Black women to get screening mammograms?
Thank you for asking this question, Cassie. This is a important topic that is very near and dear to my heart. So when we talk about breast cancer, it's the second most common cause of death among Black women. And it's very important that we talk about the different barriers that occur for Black women to access mammography, which is the best tool we can use beyond self-evaluations in detecting breast cancer.
So from your perspective, why is it so important for Black women to get annual screening mammograms?
This area of medicine, as I mentioned, is so important to me. The reason why is we do know when Black women end up getting breast cancer, it tends to be one of the most aggressive types, inflammatory. And so if early detection can occur, it can make a world of difference as far as that outcome for that patient. So early screening is so important. And that's why I encourage Black women to, seek a healthcare provider, perform self-evaluations, as well as just have that discussion about your family history and the risk factors as far as when you should have your first mammogram.
Yeah, and so you talked about mortality from breast cancer being higher in Black women, and they're more likely to have an inflammatory, aggressive type. Do you know of any theories as to why that is?
So there are several theories out there, and no one has been able to really pinpoint why. Some of the thoughts are, is it genetic? It could also be related to other forms of comorbidities that may exist. So the question of why this is happening, we do not know, but that just kind of encourages us to go out and get that mammogram screening even sooner, because early detection can make a difference.
Yeah, and we've talked about that in pretty much all of our interviews about catching breast cancer early through regular screenings. We can catch it in earlier stages and increase survival rates. But what barriers do you see for Black women getting screening mammograms?
Some of the barriers I see are accessing quality healthcare in a continued manner. So making sure you see your doctor every 6 months, or if it's appropriate, once a year. And that can be a barrier if you do not have healthcare, or if there's not a clinic nearby and there's transportation issues. That can be, one barrier that prevents that woman from actually getting the treatment or prevention care that they need.
So do you know of any resources that these women can tap into to help overcome the barriers?
Absolutely. You really need to look at your community and see what things are available. There might be mobile mammogram screening available. Also, sometimes online, there's certain screenings that can happen that can kind of give you an idea of your risk factors. And that might prompt you to actually go in sooner to be examined. I really stress the importance, the American Cancer Society has stated at age 40 to possibly, think about getting a mammogram. Of course, every patient is different, but have that conversation with your healthcare provider. And again, the other thing is just breast exams. You are more likely to catch something and notice that there's a lump or some sort of abnormality, including a discharge from your nipple. And that can be just the first sign. And if you go in it and you're examined, you could possibly have a better outcome if unfortunately you are diagnosed with breast cancer.
Yeah, and so on this Facebook page, everyone, we've shared some links to the Mammo Van that goes around in Nevada and does screening mammograms. There's other links on this page as well to help you get to screenings. And you can always reach out to the Nevada Cancer Coalition. We have patient navigators who can help guide you to screenings in your area. And we have talked in other interviews too about the recommended age to start is age 40 for average risk women. So just as she said, talk to your doctor earlier about that formal risk assessment. And one of the guidelines we've been promoting is talk to them as young as 25. You can even talk to them sooner, but yeah, get in there and self-breast exams. You know your body better than anyone. So become familiar with what's normal for you.
Absolutely.
Is there anything else you'd like to share with the community about Paint Nevada Pink?
Yes, first and foremost, I just want to say I am honored to be part of such an amazing organization, and I love the work that you guys put out in our community. You make a difference in all areas, and I'm very appreciative of the work that you're putting forth. It makes my job as a physician easier because when I do have a recommendation, you provide opportunities for my patients to be able to obtain that screening. So thank you.
Oh, well, thank you. Yeah, and everyone continue to check the Facebook page for more interviews and updates. And if you have questions about screening for yourself, please reach out to us so we can help get those answers for you. And tune in next time. And thank you again, Dr. Curry Winchell, for being here today.
Thank you for having me.